Good afternoon, everybody. Welcome. We may have a few people joining us as the time goes on, but that's okay. We will welcome anybody and everybody who's coming in. Thank you all for joining us today. My name is Sarah Davidon, and I'm at Mental Health Colorado. We'll do introductions in just a moment. I just want to first go through some technology logistics. Right now, everybody is muted just to keep the background noise down. So if you can't hear or you're having any technical difficulties, if you could type a note into the chat box, and you should see your chat box, a little orange bubble at the top of your screen that has a little conversation icon. So if you could type a note into the chat box if you need anything, because I can't hear you if you are speaking up. And we'll be monitoring the chat box to make sure that we're capturing if there's any immediate need. Another sort of technical piece, we will allow time at the end for Q&A. So if you have anything that needs clarification immediately, feel free to type a note to us in the chat box. Otherwise, we'll hold on to your questions and allow some time for Q&A and some discussion and thoughts at the end. So what we thought we would start with before we introduce sort of who you've got here at Mental Health Colorado, if you would be able to, well, actually another technical part, we're going to be recording this, so I'm actually going to start recording. So I just wanted to give everybody a heads up that this is being recorded. So if you could, if you wouldn't mind typing into the chat box what area in the state you're from and whether there's sort of anything, what interests you about early childhood mental health. That would be great because then we have an idea of who's on, and it's also captured in the recording so that we can go back and identify what parts of the state we had represented and kind of what your interest and background is in the early childhood mental health work that we're starting on. So feel free at any time to go ahead and type that into the chat box. I see we've already got some coming in. Thank you. And then if there are any questions, like I said, just go ahead and type them in. So we'll go ahead and get started. We've got 45 minutes set aside. We may go a couple of minutes over, just because we waited a few minutes to allow people to join us. So here at Mental Health Colorado, we've got a couple of folks here who are going to be going through the early childhood mental health toolkit that we've developed. So this is Sarah Davidon, and I am the Director of Research as well as Child and Adolescent Mental Health. Our strategies for early childhood, and youth mental health here at Mental Health Colorado. I'm assuming that all of you are familiar with Mental Health Colorado because you received the information about this webinar through our network. But if anybody wants additional information about the work that we're doing here at Mental Health Colorado, you can find that at mentalhealthcolorado.org. Where you can sign up for our brainwave if you aren't already a member. You can find additional resources on our policy work, including the end of the legislative session, as well as our early childhood mental health and school mental health toolkits. So along with me here, we've got Jean Cimino, and I'm going to have her introduce herself.
Hi, everyone. Thank you for sharing part of your afternoon with us. My name is Jean Cimino, and I have been working at the statewide level around workforce development for anyone who is providing services to kids really in early childhood, specifically infants and toddlers ages 0 to 3. And I recently came on as a consultant with Mental Health Colorado to start to pilot the Early Childhood Mental Health Toolkit in communities. And so that's what we're going to talk a lot about, that toolkit today, and some work that I've started in my relationship with Mental Health Colorado. So thanks for having me.
So to begin, I just wanted to go through what we hope to accomplish in the short time we have together, but we're always available for follow-up, and at the end we have our contact information. So what we don't cover today, please feel free to follow up with us. We want to go through an overall recognition of early childhood mental health as an important part of overall health and wellness. We're going to provide a framework for a 10 best practice approach for communities in early childhood mental health. We're going to go over sort of a roadmap or kind of guidance for implementing early childhood mental health strategies across various settings and communities through these 10 best practices, and then talk about some current resources and action steps, sort of the what's next in the work.
So this is Jean. I think we're just going to give a brief overview of early childhood mental health. I think there can be some misconceptions around what that means, and we're talking about mental health in early childhood. So as you all know, early childhood is really the perfect point in life to begin to address a child's mental health because that will carry them into adulthood. When we're referring to early childhood here, there's really an emphasis on those early years, so birth to 5, but the other communities sometimes consider early childhood as birth through 8, so maybe up through 2nd grade. What's really critical when we're talking about early childhood mental health is focusing on those early relationships that are surrounding the young child. Are they developing secure attachments with their primary caregivers? And really, once that happens, it allows that baby to explore their environment and also has an impact on their brain development. So when we're talking about early childhood mental health, it's a lot of times about promotion and prevention, as well as how do we intervene and provide treatment to a child who needs some services around their emotional development. I've looked at that already, but really when we're talking about mental health of children, it's really what allows them to be able to function well in all areas of their life, in their childhood as well as into adolescence, early adulthood, and then later on in life. It's really about building that foundation as you would the foundation of a house. If it's not strong, the house is going to collapse, and it's kind of, that's a metaphor we can use in these terms as well. And so again, early childhood mental health encompasses a few things. It's about how they relate to their peers, how they behave socially, the emotions they're feeling, how they're able to self-regulate their emotions, and then how they behave in their settings. So mental health is really an umbrella term that when we refer to all of these different types of health for young children. And it's not probably surprising to know that the social, emotional, mental health of a child really begins to develop at birth and lays the foundation, like I said, for that child to manage their emotions, develop positive relationships with not only their peers, but their caregivers, be able to resolve conflicts, and then how they treat others and how they care for others. All of that is laid in the foundation of their mental health.
So this is Sarah. We're sort of doing a tag team here because we each have our passions and things to say about these important issues. So I wanted to just go through a little bit about one, kind of when we're talking about early childhood mental health, we're certainly talking about sort of our youngest citizens, sort of the birth to preschool age. But we really are also talking about that K through 2 age as well. So I think that's important to remember when we're thinking about early childhood. And in that vein, there's been some really good research that's been done around social emotional skills when they're intentionally taught in kindergarten, that these actually have led to, in longitudinal studies, really important sort of different trajectories in key outcomes, things like education, education levels, access to higher education, employment, involvement in the criminal justice system or in the youth justice system, things like substance use and also mental health. So it's important to think about the essential impact that we can have on long-term outcomes of kids by providing opportunities for intentionally taught social and emotional skills development and experiences that allow the learning of these skills and strategies. So with an emphasis on how do we teach these? So so we think about how we teach other sort of academic topics like math or reading. When kids aren't mastering the skills, we help teach them in a different way. But for some reason, we haven't quite gotten to that point with mental health and social emotional skills that if kids aren't behaving, that becomes sort of more disciplinary or punitive. And so we're encouraging folks to get away from that model and look at this as a model of teaching, that we can intentionally teach social emotional skills. So over the past year or so, we've been working, and I'll add that this is Sarah. I've been working on early childhood mental health issues in Colorado for a number of years. And when I came to Mental Health Colorado, was working on a school mental health toolkit and realized very quickly that a similar kind of sort of set of strategies, a toolkit that has kind of various kinds of strategies would be helpful for early childhood mental health as well. So we developed the Early Childhood Mental Health Toolkit, the website is here. So if you want to access it online, even as we're going through it today, feel free to do that. It's at mentalhealthcolorado.org/early childhood toolkit. So we worked with early childhood experts around the state, policy folks, advocates, home visitors, early childhood councils, families, a number of people connected to early childhood around the state, and they told us that what they think is needed to make an early childhood health system and how to make that a priority. So we tried to gather all of that feedback and information and include our own sort of, expert advice, opinion, and strategies in this to collectively create this toolkit that has 10 best practices, that has a variety of strategies that you can use when you walk away from this webinar today. You'll have in your hand a set of strategies and advocacy tips and tools to help move this work forward. So the aim of the toolkit isn't to provide a program or implement a curriculum or a specific initiative. It really is to provide a blueprint or a map for early childhood mental health that can guide community members and healthcare practitioners, pediatricians, and local leaders and early childhood councils through a set of 10 best practices, including strategies for implementing, funding, and sustaining initiatives to promote mental health and prevent mental health difficulties. So funding, resources, and time were among the frequently mentioned things that we heard when we were talking to communities that can be obstacles for early childhood mental health implementation of strategies in communities. So we're truly trying to provide this tool to help make the process less daunting of figuring out, well, how do I approach this? What are some of the best practices? What's our big framework? What's our overall plan for this? So we developed this to really sort of help as a blueprint for a comprehensive approach to early childhood mental health. So I want to give an example of, and I may have done this out of order, but it'll make sense in a minute. So an example of the kinds of things you'll find in the toolkit. So not only will you find background information and some talking points, but we really wanted to be sort of specific around some key strategies as well that communities can implement to make this key concept or best practice work in their community. So an example of that is, what in our toolkit is best practice number 5, which Jean will go through in a moment, which is early childhood programs create a trauma-sensitive climate and culture. So for those who aren't as familiar with early childhood mental health, having trauma-informed practice really means that we have practices and practitioners that are sensitive to what children might have, the experiences and the context that children might be coming to us from. So looking at recognizing that trauma may impact children so that their reactions to things perhaps are different than children who haven't experienced trauma, that it can impact them, trauma can impact children physically, it can impact them sort of psychosocially and physiologically. So those are all things that, even if we're not clinicians, anybody who's sort of touching the life or working with a young child can be sensitive to, and there are some key ways to do that. So as an example, a key concept is having trauma-informed practice in early care and learning. Some key talking points. So what we've done is given you a set of key talking points. So when you're trying to make the case for these best practices, you have some information that perhaps you didn't know or didn't have access to that might be helpful as you're talking to your community. So our key talking points here: more than 2/3 of children in the U.S. experience trauma. We're talking about things such as caregiver substance use, abuse, neglect, but before they turn 16. And particularly important is that the impact of traumatic events is higher for kids under the age of 5. So in all of these talking points in our toolkit, which you can find online, and we also will put a PDF version up, we have citations. So if you're looking for the specific citation for any of our talking points, we have those available in our toolkit. So this is just an example. You can go through these in detail in the toolkit, but we really just wanted you to sort of to give you a better idea of the kinds of things that you can find in the toolkit, and we tried to be very sort of hands-on on our strategies. So the sections of the toolkit are what do I need to know? That has the key concepts and the talking points for you to sort of take and use as you you know, maybe you're speaking to your county commissioners or an early childhood council or legislators. We have a set of 10 best practices that we'll go through. We have a community conversation checklist, so a tool that's available to you to use and sort of going through with communities, kind of where are things? What's the readiness? Where are we on some of these 10 best practices? We have a section on funding initiatives. And then we also have a section at the end on finding more resources. So we have links to a number of things that people have said are pretty important resources that they want to know. So accessing data, accessing other tools that can be important in supporting early childhood mental health strategies in your communities. So here's the community conversation checklist that I mentioned, and Jean's going to talk a little bit more about how this is going to be used in communities that she's working with, but I'll give you a quick overview of it. I know it's hard to see here, but we have a set of 10 best practices, and again, these aren't specific programs. We're not saying use this curriculum or prescribing anything. Giving that kind of an overview of what kinds of best practices we know work for early childhood mental health in communities, and then it's really up to communities to figure out how they're going to uniquely address these. So this community conversation checklist, which also we started out calling it the community assessment tool, and then realized the term assessment may be a little frightening to folks, you know, sort of, you know, we're being graded on our progress, and that really isn't the intent of this tool. The intent of this tool is to start a conversation about where the community is in these 10 best practices. And I'm going to turn it over to Jean now. Yeah. Okay. Yeah. Or what you're.
Okay. So, hi everyone, this is Jean again. So, if you want to follow along, if you're on Mental Health Colorado's website, on the Toolkit website, if you go to Section 2, What Works, that will help, that will actually provide more details about what I'm going to sort of briefly go over in our time together right now. So Sarah mentioned the toolkit is based on 10 best practices with regard to comprehensively approaching early childhood mental health. And I'm just going to go over these, like I said, fairly briefly, and you can do more digging if you'd like online. So the first one is really about screening. When we're talking about promotion and prevention of mental health problems later on, screening is a really important thing that we can do to get a sense of what might be going on with either a mom who's pregnant or with a young child. So this is the first one, really focuses on screening. The second one focuses on early childhood mental health consultation. I don't know how many of you are aware of this evidence-based approach, but what it does is it pairs mental health professionals with people who work with young children and their families. And where you're going to see a lot of consultation happening is in early care and education settings like child care, as well as through home visiting. So there are some, the toolkit provides, again, those key concepts and background information around this as a best practice in your community. The third best practice is around integrating mental health and primary health prevention. So we know that children are a common place to see young children is when they're going to their pediatrician. And so one way that we can really address their mental health, their development, and any concerns that might be going on is through the pairing of integrating that mental health and primary health prevention. And it's covered through a diverse set of funds. What's really important, obviously, to early childhood mental health is the wellness of the caregiver. And when we're talking about the caregiver, that really can be a variety of folks. So it could be their mother or father, it could be their adoptive parent, foster care parent, early care and education teacher, any adult that's really having regular, building a relationship with the child. And so how do we support their wellness? Because the relationship between the child and the caregiver is really critical to the mental health and development of the child. And so this one is really important. And as Sarah alluded to already, we want to ensure that early childhood programs are creating that trauma-sensitive or trauma-informed climate and culture to be able to comprehensively take care of children, whether they've had an adverse childhood experience, which is also considered maybe a traumatic event, and that we are properly being able to support them in that environment. And the reason that some of these best practices are focused in the early care and education program is because we know kids spend a lot of time in those out-of-home care, and so that's a really unique setting to be able to adequately address their mental health and their development. And best practice number 6, again, is just kind of in addition to what I was just talking about, is that the early care and education setting is creating an environment for positive mental health, positive support, positive behavior, as well as positive social emotional learning. In addition to that, we want to ensure that we have an adequate and well-supported workforce, and they have with specific expertise in infant and early childhood mental health. And so this is anybody really who is providing services to young children. Again, that could be early care and education providers, home visitors, early childhood mental health consultants, clinicians. So really those folks who are providing anywhere from promotion to prevention to intervention services for young children. And actually my other job, which is with a statewide membership association called the Colorado Association for Infant Mental Health, we have our primary program that we offer is the Infant Mental Health Endorsement, which really supports that the workforce, those folks who are working with young children, have a set of competencies to be able to provide those targeted and quality services that are supporting and maybe treating a child's mental health and development. Okay, best practice number 8 is specific to a diagnostic tool. The DC 0 to 5 is the diagnostic classification of mental health and developmental disorders of infancy and early childhood. And so this is something that is used and recognized in the system for diagnosing mental health and developmental disorders for young children. So in the event that they need more of those intensive intervention services, this is a diagnostic tool that can help guide them to the appropriate services. So the reason that this is the best practice is for a community is that when they're encountering children who need more of those intensive services, are they getting diagnosed properly using this tool? And are there folks in that community who are trained on how to use this tool?
And this is Sarah. I just want to jump in for a second and just add that some of you might be our Brainwave members who may be familiar with our mental health parity bill that we just passed. And one of the things that we were able to get into our parity bill, so it's now in state statute, is that the DC-05 is a tool that's recognized and covered through mental health parity. So just wanted you to be aware that our parity work also includes early childhood mental health.
Great. So again, we're jumping back to those early care and education settings. And one thing that's important to think about is how are we ensuring the quality of those settings for kids? And how are we assessing that there needs to be improvement? What are those strategies for doing so? And one strategy that's important to ensuring high quality education for young children is that the caregivers are in that unique position to support the children's social, emotional development and mental health. And so what does that look like within a center? And so that's something that the toolkit addresses for communities. And then our last best practice is around the issue of suspension and expulsion rates. Believe it or not, kids in preschool can be either suspended or expelled based on their behavior, and that can have really severe consequences for a child under the age of 5. You know, if they're suspended or expelled, they're really experiencing that early learning environment is not welcome and not able to support their behavior. So I think you've probably heard a lot about challenging behaviors and how early care and education programs address those challenging behaviors in kiddos. And if they're not, if those caregivers are not really aware of what might be going on and the services that might be available in their community to support this child, oftentimes they are suspended and expelled. And I believe there's someone on the webinar who was asking about young kids of color and how we address their mental health. And this is where we see a huge disparity that kids, boys specifically
African American boys,
are expelled at higher rates than their white peers based on behavior, because they're not in positions or in programs that are suited to provide them with high quality care. Do you want to say anything else about that? Or?
I would just add to this for those who are interested in our policy and advocacy work that a bill was passed this year, one that has been tried for the last couple of years, that now it's going to help mitigate some of these early childhood program suspension and expulsions. Now remember, we were talking about early childhood, including kids who are up through 2nd grade. So this legislation that was just passed is a K through 2, so kindergarten through 2nd grade, and it limits the circumstances under which children can be suspended or expelled. So what we had seen in the past is that for sort of kind of, I won't say benign, because I'm sure they felt pretty impactful to the teacher who was in the classroom, but for things like defiance and sort of, behavioral disciplinary issues, kids were being suspended and expelled, as young as at the age of kindergarten. So this bill will limit the circumstances under which those occur, and we're hoping that through our early childhood mental health toolkit and our school mental health toolkit, we'll be able to support the schools and communities around what alternatives are in place for these kids. So I want to go now to funding. So not every type of early childhood mental health best practice that we just went through is going to require funding. I mean, for example, there are ways that we can support caregiver wellness that aren't necessarily a, $50,000 project. There are little things that we can do every day to ensure that caregivers are not only feeling supported, but they, in fact, authentically are being supported. Some things do, in fact, require funding. So when trying to initiate or enhance prevention and wellness and mental health services and supports, knowing how to access and how to leverage funding sources can be particularly important. And especially if you're in a community working with your community partners, if you can bring in knowledge of funding strategies, that can be a nice carrot to dangle that, hey, I not only want all these best practices to be implemented in my community, but I have some information about the great grant funding sources. So we developed some early childhood mental health funding strategies. Some possible funding strategies are looking at local initiatives to increase property taxes. That doesn't work in every community, but it has worked in some communities. So to look at what's called the mill levy. Other ballot measures, such as sales or marijuana taxes, have been used in our state. Looking at philanthropic funding, that tends to be a way that many of our early childhood mental health supports and services are funded in our state. But that's not always a sustainable source of funding. So look at philanthropy as a complementary source of funding to other sources. Health insurance and parity, as I mentioned, the DC 0 to 5 is going to help with using health insurance to cover young children's care. Reprioritizing the use of existing early childhood or school budgets to direct it towards early childhood mental health. Using county or other community partners, and also looking at funding via national and state and local public grants from the state or from the state legislature. So looking at how public dollars can be used to support early childhood mental health. Just really quickly, in our toolkit, we have a set of funding examples for every one of the best practices. So we have a funding strategy. And here's an example of using county partners such as Public Health or Department of Human Services. We describe kind of what it is, what is this possible funding that can be used, and then we talk about the best practice that could be supported to help you kind of connect the dots among the funding strategy and the best practices. And then we provide examples for each one of these funding strategies for what it might look like in your community or in practice. Our 6 steps to change are a set of kind of 6 steps that anybody can use to promote early childhood mental health in your community. We've outlined the 6 steps in more detail in the toolkit. I just really quickly want to run through what they are. So identify your community partners, assess what exists, and the community conversation tool can be helpful in assessing what exists. Identify which best practices could be improved or promoted. Working with an early childhood champion, build support for improving early childhood mental health in your community. Share the assessment tool, share the results, share what you've found out in talking to your community partners. And then once you've identified your champion and looked at best practices, figure out ways to go back and have continued conversations and not have this be a one-and-done process. And Jean, do you want to talk about some of the work that you're doing with communities?
Yeah, so this is Jean again. I'm super excited to just be on the cusp of working with a number of different communities across the state to sort of pilot the toolkit and really start to have these conversations around what best practices are being implemented in their communities, how is it going, what kind of funding do they have to really sustain some of these activities. And I imagine it's going to look quite different from one community to the next. Right now I'm just in the process of having introductory conversations with different community members and stakeholders around are they interested in having these conversations, who should be at the table, what do they need moving forward to be able to address some of these best practices. And really the idea around these community meetings is not to make sure that they're addressing every single best practice, but really looking at what's going well right now and where might there be gaps and what opportunities does your community have to be able to address some of these. So even if we spend all of our time really digging into one best practice, that feels like a great place to start and a win for really moving this work forward. The really exciting piece is that through Mental Health Colorado's funding to support this work, we do have a very limited amount of money to be able to support up to 9 communities. I'm working directly with the early childhood councils, at least from the beginning, with making these initial contacts. We have a limited amount of money that we can really offer to those communities to help with their planning and really support any resources that they might be using to sort of continue these conversations and plan next steps within their community. So I'm sure you'll be hearing a lot through maybe the Brainwave Network about the different things that we learn and the work that we're doing with these communities.
So we wanted to open it up now to, if you have questions, we'll have you type them in the chat box, and we'll see if there are questions that have already come in. But if you have a question or a thought or something that you think we need to consider as we're going out and doing our work with communities around sort of comprehensive approach to early childhood mental health using best practices, what should we be thinking about? So looks like we have a question that came in. Have Douglas County School Board or Douglas County Commissioners reached out to utilize the resources you provided? So Douglas County, we have had some connection with Douglas County, actually through their, this is Sarah. I met with their superintendent along with some of Douglas County's mental health folks in the context of a student youth group who started a mental health nonprofit called Oasis, and they're working to promote mental health for students in ways that their students can be more mentally healthy in the context of suicide prevention. So yes, we have worked with Douglas County schools, and they are aware of and familiar with our school mental health toolkit. But right now we have not, we're just starting the implementation of the early childhood mental health toolkit, so have not yet entered Douglas County with the early childhood mental health toolkit. Were there any questions that had come in before?
No, we were
okay.
Talking about the bills and otherwise introductions.
Okay. Mm-hmm. Great. So, I mean, it was great to hear from all of you who are kind of out there on the ground in our communities. So what kinds of things have you seen? And some of you may be kind of new to the early childhood mental health domain. But what kinds of things would be helpful for you to have information, or what do you think you might be able to do to help promote the early childhood mental health strategies? So I'll wait for other questions to come in. I think they say you're supposed to wait until the pause becomes incredibly uncomfortable, and that's when you know you've given people enough time. I think we have another comment that came in. So we'd love to have you present the toolkit at the coming Raise Colorado meeting. Well, we would love to. So in addition to Jean's work, working with the early childhood councils and going out into communities, we are also available, and I've been doing some of this is Sarah, to do presentations, to lead conversations, to facilitate discussions to community groups, to statewide organizations, to really promote this as sort of a concept and a tool that across the state we can use. So I would encourage you, I'm going to go to the next slide. We're still going to take questions, but I want you to have our contact information here. I would encourage you that if you want sort of a presentation on the early childhood mental health work, that you contact me, Sarah. And if you have sort of thoughts or interest in talking about sort of what's going on the ground, which communities we're working in, you reach out to Jean. So I would love to present at, and I guess I'm not familiar with Raise, so the Raise Colorado. So I would love for you, the person who wrote that comment, JC, if you could email me and give me some details, and I would love to talk with you about doing that. So then we have another question. Have you found resistance to mental health and social emotional learning from families of color as it pertains to implementing the toolkit? We don't know about implementation of the toolkit at this point because we're just starting out, but what I can say is in early childhood mental health in general, we need to be very aware of cultural differences in sort of acceptability of mental health supports. So, and I think that's not just an issue of race. I think that's also, sort of cultural, ethnicity, religious. I think there are a lot of different cultural factors that we need to take into consideration. So certainly we've needed to sort of look at cultural differences in accessing services and accessing treatment and accessing mental health supports, even the language that we use, and not just around stigma, but just in sort of help-seeking behavior. And help-seeking behavior can really look different across different cultures. So we tried to be very aware of that in the development of the toolkit and the strategies. And as I mentioned, there's nothing in the toolkit that's prescriptive. So we really feel that, this is sort of a guidebook to what can happen in communities, and how that will actually look needs to be tailored to the diversity and the demographics of the community. Mm-hmm. So we have another question. How are you able to assess moms around postpartum depression? So in the toolkit, we have some strategies that have come from various national organizations around both the ways tools to address perinatal depression, but also sort of the periodicity with which it, best practice says it should be happening. What we're seeing now is more and more perinatal depression and anxiety screening can happen in pediatric practices. So pediatricians' offices are able to screen for and bill for and get reimbursed for maternal depression and anxiety screenings, which up until just a few years ago hadn't been able to happen. So I would urge you to look in the toolkit for the recommendations from organizations like the American Academy of Pediatrics and a few other organizations. And we really have a strong opportunity now in Colorado and nationally to make maternal depression and anxiety screening and substance use screening as well a priority. We've had some legislation that is allowing that to happen at a schedule that makes sense for both providers and families, and providers can now get reimbursed for those services.
And Achilles asked about the recording being made available. We will be sending that out to the Brainwave Network, right?
That we posted on our website as well, so we'll make sure it's posted in the Early Childhood Toolkit section of our website. So we have another question for moms who may have given birth to living children but that have a pregnancy loss and do not have a baby, to encourage that check-in. Absolutely. So when I talk about screening, I like to talk about it as perinatal screening, which can be any time around labor and delivery, so that can be before labor and delivery or after, and during pregnancy as well. So during pregnancy, if there is a miscarriage or if there's something that sort of doesn't go as planned with the birth, that the depression and anxiety screening should still be there and are still covered. through our insurance systems. So absolutely, I think that's a great point, and particularly because that's a loss in addition to sort of the stress of potential new motherhood that certainly could cause depression or anxiety that we absolutely need to pay attention to. Yes, so that's a great point that we need to. This isn't just about postpartum. This is about pregnancy-related depression as well. So we do want to respect everybody's time. We are at time. If there's one last question, happy to take one last question before we close up. Okay. And seeing none, we are happy to be available to you if you want to give us a call or send an email or go to the website. And our Early Childhood Toolkit is online. It's got a lot more detail than we were able to go through today, so I would really encourage you to, at your leisure, find how you think you might be able to connect to these best practices and bring them into your communities. And we are here to support you in doing that. So I want to thank you all for participating in the webinar today. I'm really excited about the number of people who joined us and your interest in early childhood mental health. And feel free to reach out with any questions or thoughts that you have moving forward. So
thank you, everyone.
Thanks very much.